Hello, welcome everybody. My name is Ian Down. I use he, him pronouns, and I am the Policy and Research Lead at LGBTIQ Plus Health Australia. LHA acknowledges the traditional owners of country throughout Australia, their diversities, histories, and knowledge, and their continuing connections to land and community. We pay our respects to all First Nations people and to elders past, present. I'm joining today from the lands the Gadigal people with the Eora Nation, and I pay my respect to their elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander people joining us today. I recognise that sovereignty was never ceded and that this always was and always will be Aboriginal land. As we gather for this session, I invite people to take a moment to reflect on the lands you're joining from and the deep histories that continue to shape them. Please feel free to use the chat function to share your location. All right, so before we begin, just some housekeeping notes. This webinar is being recorded and will be made available on LHA's website. If you prefer not to appear in a published video, please keep your camera turned off. Unless you let us know otherwise, either in the chat or by contacting us after the session, we will assume that you've given consent to be a part of the recording. So today's session will be a little different from our usual format, because this particular topic and Aaron was scheduled to deliver this around about the same time last year as the reforms for vaping were being introduced. But it's been delayed for various reasons, and now more than a year on from the reforms, the landscape has shifted. And in light of that, we're taking a more interactive approach. So there will be a presentation, but our guest speakers will actually begin by asking you what you would like to hear from this session. So yes, you let our presenters know what you'd like to speak about in relation to vaping in Australia. So that could include usage rates, health impact, policy, or access to vapes. The session will be tailored to reflect your interests. If you'd like to contribute during the session, please raise your hand. You're also welcome to use the Q&A function and the chat if you'd like to ask any questions, and I can facilitate that process. And finally, if anything raised today causes any distress or brings up any concerns for you, support is available through QLife. QLife provides free, anonymous peer support and referral for LGBTIQ plus people across Australia. Visit qlife.org.au for information. All right, so our guests today are Dr. Aaron Layler and Amy Herbert from the Alcohol and Drug Foundation. So Dr. Aaron Layler uses she, her pronouns and has been Chief Executive Officer for the Alcohol and Drug Foundation since 2017. She's a recognized leader in the health policy and not-for-profit sectors with more than 20 years experience as a clinician, researcher, advocate, and executive. Aaron also serves as Deputy Chair of the Australian Institute of Health and Welfare and is a member of the Australian National Advisory Council on Alcohol and Drugs. Amy Herbert also uses she, her pronouns and is Manager of Policy and Engagement at the Alcohol and Drug Foundation. Amy has a strong background in public health and policy with particular expertise in evidence-based drug law reform, harm reduction, and strategic engagement with community government stakeholders. Together, they guide us through the emerging evidence on vaping, including the most recent data from the National Drug Strategy Household Survey, and discuss what the new regulations, now in effect for just over a year, have meant, in particular for LGBT people. So please join me in welcoming Dr. Aaron Layler and Amy Herbert. Thank you.
Thank you very much. As you've heard, this was a presentation that we had originally intended to provide about a year ago when there was quite a lot of debate and discussion in the Australian, across the states and territories and federally, around the best way to address what was being seen as an increase in vaping related harm, and vaping particularly among young people. And for various reasons, we didn't manage to present the presentation then. And so we've found some time now, with almost a year since those regulations were changed and policy was changed. So what I'm going to do today is just, I'll start by acknowledging that I'm on the lands of the Wurundjeri people of the Kulin Nation. I'd like to pay my respects to elders past, present and emerging, and to acknowledge the traditional owners of the lands that you're all attending the presentation to from today. But I wanted just to start with an outline of what Amy and I will be covering today. I'll be doing the bulk of the presentation and Amy may be involved in the Q&A. But really, we plan to talk about the various issues that are debated around vaping. And I think there are many of you on this webinar who probably have a deep interest in this and have been involved in a lot of the conversations around what is the problem we're trying to fix, how real is the problem we're trying to fix, and how do we know whether we're fixing it. We're going to talk a little bit about changes in the vaping landscape, so the policy changes that have come into place, the way that those have been implemented across the country, and the changes in which the changing environment. It hasn't stayed the same even since the federal regulations were put in place. And then we're going to finish with sort of the implications for people who vape. So really, has this worked? What's been the outcomes of these policy changes, and do we think they are being effective in addressing the issues that we were seeking to address from the very beginning? So I'm just going to pause there and invite you to share via chat or with your mic off whether there's anything else that you were hoping we would cover today, whether this is pretty much what you were hoping to hear, and then we can move in to the bulk, the presentation. So if I'm hearing nothing, I will continue and assume that this is what people were hoping for. So if we start with debating the issues, and I think a number of years ago, as we started to see vaping rates increasing, particularly amongst young people, there was significant commentary in both the media, social media, in public health forums, in harm reduction forums, around what exactly are the harms associated with vaping. And these ranged from harms associated with nicotine toxicity and nicotine dependence, people moving from nicotine vaping products to tobacco use. For some people, there was a view that vaping's linked to mental ill health among young people. So we know that there is often a relationship. We just don't know if vapes cause mental health issues. And there was also a lot of debate around developmental issues, particularly in young people. So animal studies had shown that nicotine could impact developing brains, but we just don't know yet how that would be realised in the instance of vaping. There was a fair bit of commentary around injuries and burns and lung disease and injury, particularly EVALI. And when this was appearing in the media, there was a lot of commentary around it. It is extremely rare. People were pointing out that this is not in all vapes. It's in particular types of vapes with particular types of substances. And it became a bit of a red herring in the public health kind of field around what exactly are the harms that we're seeking to address. But fundamentally, across most of the conversations that were happening, is that whilst we know that vaping products have been around for quite a long time, they haven't been used at the rate in which they were being used about 5 years ago, and that no one had done good studies looking at long-term effects of vaping. with or without nicotine in the products, and that it was unknown what the long-term effects would look like. And so most people were proposing that we adopt a precautionary principle, that we really seek to be cautious in the policy levers that we pull while we wait for more data around the long-term effects. And then towards the time at which the policy regulation was being debated in the federal parliament, there was real debate around the benefits associated with vaping. And for many of the people in the harm reduction world, this boiled down to the fact that nicotine vaping products were considered to be much less harmful than tobacco. Nicotine itself wasn't considered to be a significantly harmful substance, whereas all of the other chemicals and ingredients in combustible tobacco were what was putting people at risk and increasing their risk of long-term health issues. So there was a view that vapes were better than tobacco. And there was also quite a lot of debate around the role of nicotine vaping products in smoking cessation. And there had been a review done by ANU that hadn't really supported that, that fact. And then a Cochrane review came out not long after that that gave pretty compelling evidence that nicotine vaping products were more effective than other nicotine replacement therapies for smoking cessation. So these issues were all being debated, and amongst that was the recognition that there was that the impacts of vaping, or the prevalence of vaping, was very different among different cohorts. So what you've got here are a couple of graphs from the last National Drug Strategy Household Survey that's published every 3 years by the Australian Institute of Health and Welfare. And this has been tracking vaping, regular cigarettes, e-cigarettes, smoke and use e-cigarettes, and abstain from both in various age cohorts since 2016. And you can see in the graph on the left, which is for all adults aged 14 and over, there has been a real shift from using not smoking at all. So abstaining from both has remained fairly consistent amongst all of them, but a real shift from regular cigarettes to e-cigarettes only in the most recent year. And this data was pretty important because there was a view that as more and more people were picking up vaping, we were seeing more and more people using nicotine. And the data in that graph suggests that actually the number of people who are abstaining from both has remained pretty stable over the last number of years. It's the graph on the right that became more concerning, and this is the graph that picks up the 15 to 24-year-olds. And you can see again that there was a shift from 2016 to 2019 in those that were just using regular cigarettes to e-cigarettes or using both. But in the most recent year, we saw a drop in the number of people who were abstaining from both. So there was this effect of more people using nicotine via either regular cigarettes, e-cigarettes, or both from 2016 to 22, 23, although the majority of them were using e-cigarettes only, and many would argue that that's less harmful than tobacco. When we looked at gay, lesbian, bisexual people in this data, in this survey, the data will not be a surprise to anyone on this webinar. The daily smoking rates were dropping in this group as in the rest of the population, from 28 to 14.2%, but still at higher rates than heterosexual people. And gay, lesbian, bisexual people were 2.1 times as likely as heterosexual people to currently use e-cigarettes. And there was reasonably high, compared to heterosexual people, lifetime use amongst gay, lesbian and bisexual people. So as with risky alcohol consumption, illicit drug use, daily tobacco, current e-cigarette use, higher in gay, lesbian and bisexual people groups than in heterosexual people. So then there was quite a lot of discussion, as I said, around can vaping help people quit smoking, because this was part of the debate that was happening when the policy was being developed. So if there is a scenario where vaping isn't very useful in smoking cessation, then some would argue that there's not much point from a public health perspective to be continuing to enable access to vapes, nicotine vapes. And it was at this time that the Cochrane review came out. So it was very handy to have good evidence that using therapeutic nicotine vapes helps some people quit smoking compared to traditional nicotine replacement therapy. But, and you'll see in a later slide, given the potential health risks and unknown long-term impacts, vapes were not recommended as first-line treatment in Australia for someone who wanted to quit smoking. So at this point, with the data that I've just shown you, the current issues being debated, lots and lots, you will remember every second article that you happen to see in the paper related to some dreadful outcome from people using vapes or children using vapes or schools excluding children who used vapes. And so the government acted. And this happened at a time when I would have been doing this presentation just about a year ago. And there was a period of staged regulatory changes as they sought to debate the bills, the draft legislation in Parliament, and then implement it. And so from the 1st of January 2024, all disposable vapes were banned from being imported, even with a prescription. And then on the 1st of July that year, all vapes required an import permit and must meet TGA requirements, which included limiting flavours and strengths, only being available in pharmacies and not online or from shops, and they must have a prescription. So on the 1st of July, we moved to a prescription-only model, which had real concerns for many of the harm reduction groups, because any barrier to accessing these sorts of products is a barrier that pushes people to be more likely to use tobacco. And there are a whole lot of issues with that, not just health, but cost and other considerations. And so on the 1st of October, the government brought in a change to that legislation which allowed vapes to be bought without a prescription, but they had to be from pharmacies, and it was for anyone 18 and over. So the federal government legislation was that people under the age of 18 would still require a prescription, and plain packaging was required. Then we started to ask the question of, well, if we're going to make vapes available through pharmacies, are they available? And I think anyone who vapes knows that it's incredibly difficult to get a vape through pharmacies. Not all pharmacies stock them. And pharmacists themselves are really experiencing uncertainty and needing guidance in this space. There was a study done earlier this year, which was a qualitative study interviewing pharmacists about their experience with supplying nicotine vaping products for smoking cessation. And they were really experiencing uncertainty, hesitancy, lack of confidence in supplying these products for people who were wanting to quit smoking. They were really uncertain about the risks and harms associated with vaping, partly because what they were hearing was through media, and there hadn't been a lot of communication around the evidence for the harms associated with vaping. There was apprehension around the regulatory complexity of supplying nicotine vaping products. And when I step into a later slide, you'll understand why that's the case. We monitor this every day. It's part of our job, and we can't even keep up with the changes, the speed of change in the regulatory environment for vaping products across all jurisdictions. And so pharmacists were calling for more education and support. And you will remember that when the legislation was changed, so in October last year, the Pharmacy Guild was voicing very strong objections to vapes being made available in pharmacy, and considered themselves to be that put them in the position of being someone that was supplying something similar to tobacco. So, as I said, some states and territories already prohibit individuals from having any unprescribed nicotine vapes, and the laws are enforced differently in each state and territory. One of the things that we're keeping an eye on that is still changing, probably not as much as we would like it to, is that in some jurisdictions it's still considered a criminal offence to have nicotine other than in tobacco form. But the Australian government has stated that it won't seek to criminalise people for possessing a vape without a prescription for personal use, and that was at the time when prescription was required. And this table here really shows you why it's so hard to keep up with what the regulations say in each of the jurisdictions. So this table is up to date as of today. It probably won't be up to date in another couple of months. But what it does tell you is that if you're over 18 and you are wanting to purchase a vape, you are allowed to do that without a prescription, so consistent with the federal government regulations, in all jurisdictions except for WA and Tasmania. In Tasmania and WA, even adults still require a prescription. Now, one of the interesting things about this emerging difference is that it will allow us to start to see what the differences are in access, uptake, continuation of nicotine vaping products for smoking cessation with and without a prescription, because we've got different situations in different states. But ideally, we would see removal of as many barriers as we could for people who are trying to access them. If you're under 18, it becomes more problematic. So in some jurisdictions, you can access with a prescription, but in 3 jurisdictions, South Australia, Tasmania and Victoria, even with a prescription, you are not allowed to access a nicotine vaping product. So we talked when the regulations were being introduced about people who may be nicotine dependent, particularly young people, and if the supply to nicotine vaping products was suddenly cut off, what that might mean for them, getting people to understand what withdrawal from nicotine might look like so that they could support young people who may be withdrawing for nicotine. And I think this is something that we just need to be keeping an eye on. So if we think about why the regulations changed, as I mentioned, it was largely around growing concern about young people vaping. So regulations were really aimed at reducing teen and youth non-smokers' access to vapes. But there was also a growing awareness that there was an increase in disposable vapes, many of which were poor quality. They had nicotine or claimed they didn't have nicotine, but may have had nicotine that were being sold online and in shops. And many of them hadn't been tested, ingredients weren't always known. And there were many instances where people were accessing what they thought were non-nicotine vaping products, and they actually had quite high levels of nicotine in them. So if you bear in mind that was the key focus of the regulatory change, then we jump to the impact of those regulatory changes. And it's very early, so it's still not even 12 months since we saw the change in October of last year, and there are a number of mechanisms that are monitoring vaping rates in young people. And I'll talk a little bit about the data that is or is not available for monitoring access to nicotine vaping products for people who need to be able to access them. So the data that I'm going to talk about now is from the Gen Vape reports, which are done by the Cancer Council in New South Wales, funded by the federal government and the New South Wales government. The Gen Vape reports have been being repeated every 6 months for a number of years. They're up to wave 8, and the wave 8 data was released yesterday, so it's relatively new, hot off the press. So what you can see in the data here is that vaping and smoking rates are declining in adolescents. So February 22 is before the regulations were changed. Wave 6 is immediately before the regulations were changed, and wave 8 is from April of this year. And in that time, we've seen an increase in the proportion of young people, so 17 to 14, I think, who have never vaped. We're seeing a reduction in the number of young, or the proportion of young people who are vaping less than 10 to 100 or more than 100 occasions. But interestingly, we're also seeing that there is an increase in never smokers and a reduction in those that are smoking less than 10 or more than 100 cigarettes, but a slight increase in those smoking 10 to 100 cigarettes in their lifetime. And when Mark Butler was in the media yesterday, he was identifying this as a real success of the regulatory changes, feeling that we've peaked in youth vaping rates and that we're seeing a benefit from the policy changes that were implemented late last year. The other thing that the Gen Vape report identified is that we're seeing a lot less promotion on social media. So when they talk to young children, or where they've seen or heard promotions for vapes before the regulatory change, about nearly 20% of them were seeing it on TikTok, nearly 13% on Instagram. So lots of social media channels promoting vapes, and that's really reduced in Wave 8. So less than 10% in each of those categories now seeing promotion for vapes on social media. However, when young people were asked, where did you get your vape from? About a third of them are still saying at a tobacconist/vape shop. So we live in a world in Australia now where theoretically you're not able to access vapes from anywhere other than a pharmacy, and yet a third of our young people who are vaping are still accessing it from a tobacconist or vape shop. And this has been one of the challenges in the regulatory change, that enforcement becomes key. We speak to people all the time who continue to see vaping shops popping up in their local area, and the enforcement of that, of the outlets for vapes, is a states and territories obligation, and that the mechanisms for which they do that vary across the country. And there's quite a bit of focus at the moment in some of the jurisdictions around what we can do to better enforce compliance with a pharmacy-only model. And then the other data that I think is really interesting in this space is the perceptions around statements about vapes. So you can see here that some of the questions that are asked are derived from the issues that were being debated. So are they safe? Do they harm the developing brains? Do they damage the lungs? Can they cause addiction? And then there are statements about vapes being healthier than smoking, helping smokers quit, and nicotine being harmless. And I think that some would say that you would want to see more young people agreeing with the negative statements around vaping and disagreeing with the positive statements around vaping. But from a stigma and evidence perspective, some of those positive statements about vaping, i.e. vapes help smokers quit, are actually evidence-based. And yet we've got relatively low levels of young people agreeing with those sorts of statements. And then finally, before I step into just a view of teacher and parent agreement on those positive benefits of vaping, I think it's really insightful to see the data around why young people start to smoke or vape. And we know from the National Drug Strategy Household Survey, when we're talking about illicit drugs, that for many people, they try them because they're curious. And you can see that before the regulatory changes, before we started to really push out campaigns around vaping being harmful, vaping being bad, some stigmatizing messages about vaping, the majority of young people were trying vapes because they were curious. And that has really dropped off. So curiosity is no longer a real driver of this, and that would be seen by many in the public health space to be related to the campaigning that's been done, talking to people about the risks associated with vaping. And then the Gen Vape surveys also talk to parents and teachers. And I think in this you can see, even with adults, their agreement of some of those evidence-based facts, e.g. vapes help smokers to quit, is very low, and for parents is declining. So when we think about parents that may be smoking, who are able to access nicotine vaping products for smoking cessation, the message is not really getting to parents in the same way that we might want it to from a harm reduction point of view. And I think that's always one of the challenges that we face when we're looking at public health campaigning, where there's very much a view that we need to, so the prohibition versus harm reduction kind of messaging. Then the other space that I think we're really interested in is, are the policy changes having an impact for adults and for smokers? And at this point in time, We really don't know. We don't have a lot of data on prescriptions, on availability of nicotine vaping products for smoking cessation. We don't know how many pharmacies stock and supply nicotine vaping products, and the anecdotally is that it's not as many as we might want it to be. There's no data on whether people are getting prescription for under 18 anymore, and there's no data on vape sales without a script. And we also think about smoking cessation and whether we are seeing people who are accessing nicotine vaping products to quit smoking. This one of the issues that's debated around this is that we can see people very successfully quit smoking with nicotine vaping products, more successfully than other nicotine replacement therapies, but they often transition to nicotine vaping products. Now, many of us would say that's better than smoking, and we're always going to have people using nicotine, so better they're using nicotine vaping products. And then there are other advocates who are saying we really don't want people to be using nicotine at all. And that's the conversation that kind of clouds, I think, the harm reduction conversation that so many of us are interested in having. And that's seen partly in the RACGP guidelines for smoking cessation and vaping cessation. So when the federal government changed their policy, they funded the college to develop guidelines to support general practitioners in helping people who were wanting to quit smoking using vapes. And we argued that we also needed to ensure that people who were using nicotine vaping products could continue to get access to them. And prescription sometimes made that a bit difficult, particularly if you needed to say to your GP, I'm not interested in quitting my vapes, I just want to get access to them. So the removal of the requirement for a script has helped with that. But you can see in this recommendation that for people who want to quit smoking, the RACGP really recommends first-line therapy is behavioural support and nicotine replacement therapy with NVPs as a second line. And they are making that recommendation because they believe, again, precautionary principle, that there is a lack of evidence around the long-term health effects of nicotine vaping products and that they're not registered therapeutic goods in Australia and therefore their safety and quality hasn't yet been established. So I think there are a number of supports for people who are looking to quit smoking. Most of it's, particularly around vaping, is targeting children. The Alcohol and Drug Foundation has developed a toolkit for communities to help communicate around vaping. But I think this really is one of those issues in the substance use space that is fraught. And many people are talking about the impact on children, which is an important consideration, but we're also acutely aware that there is an impact on people who use nicotine. And given that in gender diverse communities, we see nicotine used more frequently, the limitations on access, the stigma that goes with messaging around vaping, all of those are undermining sort of better health outcomes for those people that are often really needing the best support they can to have good health outcomes. So I'm going to stop there. Let me see if I can end my slideshow and stop sharing and just open it up to questions.
Thank you very much, Erin. There are a couple of questions that have come through. So Megan asks, can you speak to the risks of nicotine pouches and what data there is about the use in Australia generally? So Megan knows of young people who are moving from vapes to pouches. And one has allergies to the patches for nicotine patches, and the gum makes this person feel nauseous. So if you could speak a bit about that.
Hi, thanks for the question. My name's Amy, she, her pronouns, and on Wurundjeri country. Really interesting question, Megan. We actually haven't studied the use of pouches or done any evidence reviews on pouches at the ADF, but I am aware that they are used. In your question, you said they're not regulated. They are regulated. they're regulated by the TGA as a therapeutic good, and I just had a quick check on the website, and it looks like there aren't actually any registered as a therapeutic good, but of course that doesn't mean that you can't go out and buy them in a number of other ways, like you do with any regulated product. There's a black market for it. So I'm thinking in particular about a recent drug trends report by NDUC that looked at EDRS and IDRS surveys. So that's surveys of people who use drugs about their and they focused on use of pouches, and they found that of the people who are using pouches who also use drugs, over half of them are actually buying them from a bricks and mortar store. So they're definitely out there and pretty available. And my general understanding of the state of evidence around the effects of pouches, the health effects and risks of pouches, is that the research is limited. But there was a recent meta review, and I'll pop this information in the chat for you, that looked at the impact on oral health. And they find that there's evidence to suggest that you can develop lesions and other oral side effects of dry mouth, soreness, blisters. I don't know how you pronounce it, gingivitis, but gingivitis-related blisters and strange jaw sensations and the like. And also I'm aware of another study where they were looking at the risks associated with pouches based on, I think, their tendency to deliver really high doses of nicotine. So then the risk there is related to elevated heart rates. And otherwise, there's some interesting info on the TGA website as well, which basically sort of says there's no strong evidence to suggest pouches are useful for smoking or vaping cessation. And they do say that there's evidence around nicotine being harmful and having adverse impacts on adolescent brain development as well. But we haven't sort of really reviewed that evidence again in full. I also know there was a study, and I'll just look up the reference for you, recently around perceptions. There's a the Generation Vape report. They had a couple of questions around pouches and people's perceptions, young people's perceptions of the safety or otherwise of pouches. So that's a bit of an interesting read. So I'll pop that in the chat too. But yeah, basically, most of the studies are emergent. Difficult as well because it's a regulated product, so people are accessing it illicitly. But yeah, I think there's some increasing interest in research in the field, including in a local context. Hopefully, we start to see a little bit more about that.
I'd just add, Amy, that the Gen Vape report that was released yesterday asks the question of 14 to 17-year-olds, I think that's the age group, whether they've used an oral nicotine pouch. And the numbers are very, very low that say yes. So when they asked it for the first time in Wave 7, which would have been 6 months ago, it was 2.1%. And most recently in April of this year, it was 1.9%. So again, you see in the media lots of stories around, oh my God, young people are moving from vapes to nicotine pouches, and actually the numbers are tiny.
Thank you.
Thank you. And Megan, would you like to ask your second question? Was that your voice, or shall I read it to?
If you could read it, that'd be great. Thank you.
All right. So Megan believes that LGBTIQ plus people of faith who are rejected by family and faith community have higher rates of mental health issues. Do you have any data showing whether being LGBTIQ plus person of faith is a protective or a risk factor for the use of vapes, nicotine, or alcohol and other drugs?
And Amy might like to add, I think if I just speak broadly around protective factors when it comes to substance use, we know that poor mental health is a risk factor for substance use. So if people have a mental health issue, doesn't mean they're going to use substances or have dependence or experience harms from substances, but they're more likely to. We also know that connection to family and community is a really strong protective factor. So if you consider an individual who is being excluded from their family and if they had strong connection into a faith community, that in itself is going to be a risk factor for substance use. So when we work, we do a lot of work in the prevention space, but the prevention work that we do is really around keeping people, building those protective factors so that it's not about people not using substances, it's about if they do, not experiencing significant harm from them. And most of the work that we do is around connection to family, connection to community, connection to schools if they're young, just having a sense of place. So I think I would say that, yes, there is strong evidence that it's not so much about LGBTIQ plus or person of faith that is the risk or protective factor. It's whether the community that you are within will be strongly connected to you as an individual.
Does anyone else have any further questions? Yes, we have one now from Ruby Grant. Do we have any national data that explores differences in nicotine use within the LGBTIQA plus communities? For example, broken down by gender, sexual orientation, and other factors beyond age?
So the data from the National Household Data, National Health, oh goodness, National Drug Strategy Household Survey, goodness me, they need a different title, certainly collects data, well, only recently have they collected data around gay, lesbian and bisexual people. So they hadn't previously asked people, it was male, female, so bit late, but better late than never. And you can certainly break down now from the most recent survey to look at that data by gender, sexuality, and other factors beyond age. So you can look at rural, remote states, all of those sorts of things. Irrespective, across everything, we are seeing higher rates of nicotine use and risk use of alcohol and illicit drugs in the gay, lesbian, bisexual people cohort in that survey. So it is pretty consistent, irrespective, but you can drill down through the data cubes if you're wanting to do that on the AIHW website.
All right, well, I'll take this opportunity to bring it to a close, and thank you very much for that presentation. It just goes to demonstrate what a complex and ever-changing area it is. It's fascinating to monitor the impacts of these regulatory changes, both the intended and unintended consequences, and hopefully we'll have you back this time next year to update us and see how things are tracking and see what progress is being made. So yeah, so I'd just like to thank you for your time, for coming in and speaking with us, and to thank the audience for joining us. Just a reminder that if there has been anything in today's webinar that has caused any concern, that you can reach out to QLife for peer support. You can find details at qlife.org.au. And yes, thank you for joining the policy and research webinars, and look out for the next one, and we'll see you then. Thank you very much.
Thank you.
Thanks.
Bye.